Chapter 17: The Cell Danger Response and Metabolic Psychiatry. Introduction to Metabolic Psychiatry and the CDR. Metabolic psychiatry is an emerging field that challenges traditional views of mental health, focusing on how metabolic dysfunctions, such as insulin resistance, mitochondrial issues, and chronic inflammation, contribute to psychiatric conditions like depression, anxiety, schizophrenia, and bipolar disorder. The cell danger response, CDR, is a central concept in this model. Recent advancements suggest that, by targeting metabolic dysfunction and resolving chronic CDR activation, we can address the root causes of many mental health disorders. This chapter highlights researchers and institutions exploring the metabolic roots of psychiatric disorders, from dietary interventions to cutting-edge metabolic therapies. Stanford University. Shebani Sethi's work. At Stanford University's Metabolic Psychiatry Clinic, Dr. Shebani Sethi leads research into how addressing metabolic dysfunction improves mental health outcomes. One of the clinic's main focuses is the ketogenic diet, a low-carbohydrate, high-fat diet that shifts the body's energy source from glucose to ketones. This metabolic shift can reduce inflammation, improve mitochondrial function, and reverse insulin resistance, key factors in stabilizing psychiatric symptoms like depression and bipolar disorder. In one pilot study, patients with schizophrenia and bipolar disorder who followed a ketogenic diet experienced significant improvements in both metabolic and psychiatric symptoms, including weight loss, reduced insulin resistance, and improved mood. Dr. Sethi's research at Stanford continues to explore the profound connection between metabolic health and mental wellness. Harvard University. Christopher Palmer's research. At Harvard Medical School, Dr. Christopher Palmer has been pioneering research that reframes mental disorders as metabolic disorders of the brain. His work focuses on mitochondrial dysfunction and neuroinflammation as central components of the CDR that contribute to psychiatric conditions. Palmer's research supports the theory that improving mitochondrial function through metabolic interventions, such as the ketogenic diet, can lead to significant improvements in patients with severe mental illness. For example, Palmer's patients with treatment-resistant mental illnesses, such as schizophrenia and bipolar disorder, have responded well to metabolic therapies. By targeting the brain's energy systems and reducing inflammation, these treatments have shown remarkable improvements in cognition, mood regulation, and overall mental health. UK Metabolic Psychiatry Hub. In the UK, the Metabolic Psychiatry Hub, a collaboration between the University of Edinburgh, King's College London, the University of Bristol, and the University of Exeter, is advancing the field by focusing on the bi-directional relationship between metabolic health and severe mental illness, SMI. Their research explores how conditions like obesity, type 2 diabetes, and insulin resistance contribute to psychiatric disorders, and how metabolic-based treatments, such as ketogenic diets and diabetes medications like metformin, can improve both metabolic and mental health. This multidisciplinary approach is uncovering new treatments and therapies that integrate metabolism and mental health, offering new hope for individuals with treatment-resistant psychiatric conditions. Metabolic Mind. Nonprofit advocacy. Founded by David Basuki, Metabolic Mind is a nonprofit organization dedicated to promoting the use of metabolic therapies for treating mental illness. The organization is based on the success of using nutritional ketosis to manage psychiatric disorders, inspired by Basuki's personal experience with his son's recovery from mental illness. Dr. Brett Scher, the medical director of Metabolic Mind, advocates ketogenic therapies, low-carbohydrate diets, and lifestyle changes as potential treatments for psychiatric disorders. Metabolic Mind aims to educate families and clinicians about how addressing metabolic dysfunction through dietary interventions can lead to improvements in psychiatric conditions such as bipolar disorder, schizophrenia, and major depression. Food and Mood Center, Melbourne. At the forefront of nutritional psychiatry, the Food and Mood Center in Melbourne, led by Professor Felice Jacka, is researching how diet impacts mental health. Their pioneering work explores the links between diet, inflammation, and mental health disorders such as depression, anxiety, and schizophrenia. JACA's team has found that addressing nutritional deficiencies and improving gut health through dietary changes can reduce inflammation and improve brain function, leading to better mental health outcomes. This research aligns with the metabolic psychiatry model, showing how diet-driven metabolic improvements can alleviate psychiatric symptoms and contribute to long-term mental health. Julia Rucklidge's work, Christchurch, NZ. Dr. Julia Rucklidge, at the Te Puna Toyora Research Lab at the University of Canterbury in Christchurch, New Zealand, focuses on the role of micronutrient supplementation in treating mental health disorders such as ADHD, anxiety, and mood disorders. Her research demonstrates that correcting nutritional deficiencies can dramatically improve brain function and mental health, further supporting the idea that addressing metabolic dysfunction is key to treating psychiatric conditions. Rucklidge's work provides strong evidence that dietary interventions and micronutrient supplementation can be effective treatments for a wide range of mental health disorders. Conclusion. The field of metabolic psychiatry is rapidly growing, with research from Stanford, Harvard, the UK Metabolic Psychiatry Hub, the Food and Mood Center, and Te Puna Toyora, all demonstrating that addressing metabolic dysfunction can significantly improve mental health outcomes. By resolving chronic activation of the cell danger response through dietary, lifestyle, and metabolic therapies, this approach offers a promising path for treating psychiatric disorders. As more research confirms the connection between metabolic health and mental illness, metabolic psychiatry may reshape the future of mental health treatment, offering hope for those struggling with long-term, treatment-resistant conditions. Food and Mood Center, Melbourne. The Food and Mood Center at Deakin University, led by Professor Felice Jaca, focuses on the impact of diet on mental health. Deakin University, https www.deakin.edu.au Faculty of Health-Research Food and Mood Center. Harvard University, Christopher Palmer's research. Dr. Christopher Palmer's research on the connection between metabolism and mental health, including his theory that mental disorders are metabolic disorders of the brain. Dr. Palmer's website, https www.chrispalmermd.com. Mind Health 360 podcast, https www.mindhealth360.com/podcast/metabolic psychiatry, a unifying theory of mental illness / Julia Rucklidge's work, Christchurch, New Zealand. Julia Rucklidge's research at Te Puna Toyora focuses on the role of micronutrients in mental health treatment. Te Puna Toyora, University of Canterbury, https www.canterbury.ia.nz. Research about UC research research groups and centers Te Puna Toyora, mental health and nutrition research. Metabolic Mind. Metabolic Mind, a nonprofit founded by David Baszucki, promotes the use of ketogenic diets and metabolic interventions for psychiatric disorders. Metabolic Mind, https www.metabolicmind.org. Stanford University's Metabolic Psychiatry Clinic. Dr. Shebani Sethi's work on metabolic dysfunction and the ketogenic diet for psychiatric disorders. Stanford Medicine News Center, https jafmed.stanford.edu News, All News, 2922-11 Metabolic Psychiatry.html. UK Metabolic Psychiatry Hub. The UK Metabolic Psychiatry Hub is a collaboration between several universities, advancing metabolism-based treatments for severe mental illness. The McPinn Foundation, https joshmcpinn.org/project/hub for metabolic psychiatry/